Okay, everybody. I hopefully have got things going now. Maybe. All right, we're going to try this. I was playing this on my personal Facebook page and rather than Sanctuary, so we're going to start all over again. If you missed the first little bit, I'm still here and still try to have some time for questions afterwards. But that's what happened. Took a minute to sort that out, but we are going again. So, Ron, go ahead and get that started. Hello, it's me, Dr. Eric Potter, Functional MD from Sanctuary Functional Medicine again, sharing insights on mold and hormone balance. We have a lot to cover today, explaining the mechanisms and effects of mold toxins influencing thyroid, reproductive hormones, and our adrenal function. Before we get started, I will remind you of two things. First, this is education and not medical advice. In a group setting like this, I cannot diagnose or treat any individual patient. Any insights you learn here should be discussed with me as your doctor or regular provider before starting. You're responsible for any therapy changes you make based on this education. Second, for more education from Sanctuary, go to our video library page or sfmempower.com, EMPOWER.com. On the SFM Empower page, we have an allergy course and an immune prepper course ready for viewing or purchase. More courses will be added as we are able to produce them. Now, for our main program today, mold and hormones. At Sanctuary Functional Medicine, we care for a lot of patients who suffer from mold toxicity. These toxins arise from mold growing in water-damaged buildings in which they live, or sometimes their vehicles, cars, trucks, and so forth. Patients come to us with a long list of symptoms crossing multiple body systems. While the effects of mold toxins on the immune system may be the most widespread, the hormonal effects come in a close second. When we hear patients describing symptoms that cross multiple body systems, we think of biotoxins, which include mold, Lyme, Bartonella, toxic algae, and a few other things. The majority of those patients suffer from symptoms that directly or indirectly relate to hormonal imbalances. Symptoms like fatigue could be related to thyroid or adrenal issues. Infertility or irregular cycles can arise from mold toxin effects on reproductive hormones. Hashimoto's, thyroid antibodies, sometimes arise from mold effects through the immune system. Insomnia often complicates mold toxicity, and sometimes this is from the changes caused in adrenal hormones. Once these symptoms hint at the possible presence of mold toxins, we test for both the effects of mold on the immune system and the hormone systems. The tests often return with abnormalities in thyroid hormones like low free T3, the more active form of thyroid hormone, or elevated reverse T3, the inactivated form. The thyroid stimulating hormone, or TSH, may look normal, while the patient suffers from the symptoms of hypothyroidism anyway. Sometimes the labs come back with a flat adrenal cortisol curve in the saliva test. Normally, cortisol goes up first thing in the morning and drops to bedtime levels, allowing sleep. Without the morning rise, the patient often has trouble waking up in the morning. The level does not go down in the evening. They often have insomnia and can't get into a deep restorative sleep. They just can't unwind. Other times, the adrenal cortisol runs high during the day, causing symptoms beyond insomnia. High cortisol can trigger agitation, panic symptoms, palpitations, or other symptoms. With either low or high cortisol, short-term therapies can help with symptoms and the mold as the mold toxins are removed. No one should be surprised that the reproductive hormones suffer as well when you consider that the entire hormonal system depends on the other parts. For example, even insulin from the pancreas, a hormone, and its effects on blood sugar control interact with the thyroid and the adrenals to influence the monthly ebbs and flows of estrogen and progesterone. Another connection comes in the fact that cortisol and the reproductive hormones all begin as cholesterol, differing only in how the basic structure is modified by enzymes. Before addressing how hormones can be rebalanced in the short term, besides removing the toxins that imbalance them, we can slow down and consider exactly how do mold toxins cause such havoc in our hormonal system. Toxins of all types impact along the hormone pathway. Mold toxins may influence production of hormones, the receipt of the signals at the receptor level, the organ or tissue health level, degradation of hormones, or through secondary pathways. We can look at a few examples of mold toxins with particular effects known through research. Zearalenone and breakdown products of it influence through its similarity to hormones. We look at the structure of zearalenone. It looks a lot like progesterone or estrogen. This means it can bind the same hormone receptors, either stimulating or inhibiting the receptors. In studies, low levels of this mold toxin increase progesterone and estrogen levels. At higher levels, the hormones were decreased as cytotoxic or cell-killing effects predominated over the stimulatory aspect. Receptors which respond to zearalenone have been found in placental tissue all the way up to the pituitary. In the pituitary, this mold toxin caused a decrease in the production of luteinizing hormone. This hormone waxes and wanes during the monthly cycle, allowing reproductive cycles to occur along with follicle-stimulating hormone, FSH. Besides binding receptors, the enzymes which either make or transform hormones change in response to the zearalenone. With varying levels of enzymes, some hormones increase and some decrease, leading to clinical changes we call symptoms. Citrulline demonstrates another mechanism altering hormone levels as it lowers the viability of Sertoli cells in pigs on whom it was tested. Lower or less active Sertoli cells will affect the number and activity of sperm in pigs, potentially lowering male fertility. Besides reproductive hormone effects, mold toxins affect thyroid function. The thyroid and its hormones provide primary control over the speed of metabolic functions in the body. Too much, and things speed dangerously too fast. Too little, and the body slows down with other less than desirable effects. While providing this critical role, the thyroid and its hormones are influenced by other hormones, including cortisol and the sex hormones. These other hormones also experience changes when mold toxins are present. The influence on the thyroid can work through directly changing function of the thyroid itself or changing the downstream effects of the hormone on local tissues. At the level of the thyroid, aflatoxin B1 has demonstrated the ability to induce apoptosis, or cell death, in rat thyroid cells. In experiments with pigs, mycotoxins from Fusarium mold can result in small thyroid glands with higher levels of total thyroid hormone. In other rat experiments, patulin, after 60 days of exposure, resulted in colloid degeneration and white blood cell infiltration of the thyroid. Basically, it causes damage. It also led to lower hormone levels. Besides influencing size or production of hormones, some toxins affect the receptors to which the hormones bind. These receptors are necessary to induce the receiving cells to carry out faster metabolic functions. The mold toxins, bivucerin, ochratoxin A, and deoxynivalenol, yes, all hard to say, were shown to inhibit the receptor in studies. Another toxin, zearalenone, inhibits the production of receptor in the rat brain. The T2 toxin appears to interfere with the production of thyroid globulin, which stores thyroid hormone and may cause an iodine deficiency in the process. We can't forget the adrenals and how mold affects them. Zearalenone and Innate B also affect cortisol levels based on their own concentrations. Cytochalasin B reduces the action of ACTH, adrenocorticotropin hormone, from the pituitary that helps stimulate cortisol release. This lowers the amount of cortisol released. Citrulline may elevate cortisol levels, at least in mice, and T2 toxin does the same thing in pigs. A variety of other mold toxins influence cortisol levels up or down as well. Before opening the virtual floor to questions, let's discuss a little about treating hormones during mold detox. First, till the mold is detoxed from the person's body, the hormones won't function normally no matter what you throw at them. In the short term, we aim at control, not perfection. With that goal in mind, we start with thyroid and cortisol balance, as they also influence the reproductive hormones. If we see that our patient has metabolic hypothyroid, we consider the severity to determine if they need thyroid hormone with T4 and T3, or if they just need to optimize other factors like zinc, selenium, vitamin D, and lowering inflammation. This latter approach helps a lot of our older patients who cannot tolerate thyroid hormones without side effects like palpitations. For the younger patients and those with more severe hypothyroid labs and symptoms, a low dose of natural thyroid hormone often relieves many symptoms while we are going through detox. If a patient needs thyroid hormones, we also want to consider adrenal balance. Adding extra thyroid hormone will increase the breakdown of cortisol. If cortisol already runs low, then this may push them over the adrenal insufficiency threshold. Those patients need some adrenal support with nutrients like vitamin B5, pantothenic acid, or vitamin C, and adaptogens like ginseng, licorice root, or others. With prepared adrenal function, the patient better tolerates the thyroid hormone that we give them. If the only issue arises from the adrenals and cortisol, we work with the vitamins noted just now and adaptogens. Adaptogens, herbs which help our adrenal system work more efficiently, come in many types. We use ashwagandha, phosphatidylserine when cortisols are too high. We use ginseng, licorice root, relora, and others when the levels are too low. Many symptoms improve in the short run, allowing us time to address the deeper issue of mold toxin detox. Once the adrenals and thyroid are balanced, we turn our attention to the reproductive hormones. Women with irregular cycles or infertility challenges need gentle adjustments to the hormones when mold toxins are involved. We usually begin with low-dose progesterone or DHEA, a male-type hormone made by the adrenals. As detox progresses, we may add in estrogen and testosterone based on blood levels and the age of the patient. We use bioidentical hormones, which match the natural ones made by our bodies. All along the way, we monitor both symptoms and labs to be sure we keep them in range. With those insights in mind, let's shift our attention to your questions. Leave questions on the comment page if you have not already sent them to AskDrPotter.com. Again, for further insights, look at our SFM Empower page for courses or our video page for past live recordings and more. Go ahead, send your questions now. Let's get started with the ones that have already been sent. So, first of all, from Miss Wolf, we have it's a question about mold. Are you familiar with cases of chronic joint subluxations and joint pain in every part of the body? So what are your thoughts of potential root causes and how would you test for them? So joint subluxations can often occur with something called Ehlers-Danlos, E-H-L-E-R, next word, D-A-N-L-O-S syndrome. That's a situation where the collagen tissue in your joints are not as strong, they're super stretchy, they don't heal back when they're stretched, they keep going further, and those joints can get very hyperflexible. The person's elbow can go around, seem like it doesn't stop, or they're double jointed in knees, they can reach back and scratch their heels reaching over the top, or they can tie themselves in a pretzel. Those are very good things to do in gymnastics, but not necessarily to do if you're trying to walk down the road and your joints are popping out of place. So for those patients, sometimes that's just a genetic issue. But there's also things you can do to help those patients for their connective tissue to tighten up. Sometimes mold toxins can be one of the things that worsens that. Other forms of inflammation can cause you to have trouble healing. Lack of hormones, just what we were talking about today, making sure there's adequate DHEA and testosterone. Sometimes it's nutritional issues. If you have gut issues where you're not absorbing protein or not getting enough in your diet, we may look at helping someone get more collagen in dietary sources. Another question, how does one turn off the innate immune system when it gets stuck? So let's talk about the innate immune system, and just in case you don't know what that means. The innate immune system is the part of our body, immune system, that attacks whenever it sees certain patterns. If it looks like a bad guy pattern, pathogen associated metabolic pattern, PAMP, it will attack. It will turn up complement, it will turn up certain cells, natural killer cells, and a few other ones. It doesn't need antibodies to identify specific, it's more like a shotgun approach. That's one of the things we need to act quick with if COVID infects or any other viruses for that matter. So that innate system is the first line of defense. It then alerts the adaptive system. Now, I go into this a whole lot more detail in my immune prepper course, but that's a short version of it. In mold toxicity, the innate immune system complements some of the cytokines like transforming growth factor beta 1 can get upregulated. So number one, to turn down if you have an overactive innate immune system causing chronic inflammation, you want to remove the trigger. Now, if there's a toxin, if there's an infection, you want to remove that. And once you do that, there are other things. Some of them are adaptogens. Ginger, I'm looking at something called palmitoethanolamide, PEA. That seems to be another way that you can turn down some inflammation. There are a lot of other herbs out there that you can use to settle things down, quercetin, curcumin, things like that. Using those, removing the triggers, giving nutrients, and sometimes super physiologic, meaning higher than you would normally get in food in terms of supplements, and getting that innate immune system to calm down so it's not causing damage. It's kind of like, if yes, you want your innate immune system to be there, the fire trucks, putting out fires, finding who's starting the fires, but if they're starting to run over everything, running through walls, spraying water where they shouldn't be, they're causing problems. So you want that immune system to work at a level that's appropriate for what's going on in your body. I have an abnormal mycotoxin lab test. Doctor doesn't seem concerned, didn't offer any treatment. How would you treat this? I also have lung cancer and wonder if there is a connection. Thanks, Lawrence. I'm sorry to hear about the lung cancer. There are some mold toxins that can trigger cancer. It's more known for aflatoxin, AFLATOXIN, that mainly comes from aspergillus and growing on peanuts and some other places, water damaged buildings as well. With that, those toxins can cause liver cancer, but it's very likely that there are other mold toxins that might contribute to cancer in the first place. Even then, if you have cancer not caused by mold toxins, you could have mold toxins that are influencing how your body's responding, suppressing your immune system. So there are molds that make something called mycophenolic acid. If you want to go get that as an immune suppressant because you've got a transplant, it's called mycophenolate. So it definitely is something that if you get high enough levels from a pharmaceutical, it makes your transplant, say kidney or liver, safer so you don't reject it. However, if you're getting that from mold growing in your house walls, that could be causing you more likely to get infections or not fighting cancer as well either. So with that, you mentioned a mycotoxin lab. I'm going to assume that you had somehow got a urine test where they took a urine sample, measured whether you had levels of different mycotoxins in them, the mold toxins, mycotoxins, same thing. With that, there's a few different companies. I'm not going to name those right now, but there's a few different companies out there. I do have my favorite ones that do a little more extensive test, have a good price range on it. We occasionally use those tests. We normally use some tests in the immune system and the hormones, as I mentioned earlier in the presentation, to see how somebody's responding. But with the urine test, you can see the levels of different ones. The problem is we don't have urine tests for all the different mold toxins, so it may look good, but you may have a toxin that we don't have a test for. So with that, we would look at that urine test, determine how high it is, see if it's potentially related to the symptoms you're having, and at the very least try to find out where that's coming from in your environment and trying to get that out of your environment so it's not causing you problems. So one of the ways we do that are using binder therapies. I've talked about this in other videos and to our patients a million times, but things that you can take that either bind toxins in your stool, carry them out in your stool, or into your bloodstream and then carry it out through the urine. And also you can look if you can tolerate doing things like sauna. With that, those are ways that you can get those toxins out and then recheck that urine test to see if those levels have gone down at some point. What is your experience with helping children with autistic symptoms fully or almost fully recover health? How would you seem you be different than a MAPS practitioner? So a MAPS practitioner, the medical and pediatric specialty, I think was the initials. Basically, MAPS are kind of pediatric functional medicine doctors. When you look at their materials, their courses, it very much overlaps, except Institute for Functional Medicine focuses on all ages, and a lot of them do take care of pediatrics, and some of them have actually done either taught or taken the MAPS courses as well. But MAPS is kind of an internal functional medicine certification program for those that are doing just pediatrics. So with that, it's going to overlap. There might be a few differences, but probably no more difference than if you go to 2 or 3 different functional medicine doctors. Everybody has their little different styles. You're still going to get the same approach of looking for a root cause. Can we find toxins, say, for in this case, the child with autism? Are there toxins, past or present, that maybe triggered the autism, triggered inflammation in the brain, triggered dysfunction, or is making that dysfunction already worse? So, for example, if you're having gut issues with dysbiosis, chemicals from Clostridium, not C. diff that causes fever and bloody diarrhea, but different species of Clostridium that release chemicals that can cause imbalances in neurotransmitters. So sometimes removing those. Removing inflammatory foods. Children with autism tend to have more sensitive brains, meaning that it doesn't take as much inflammation to trigger behavioral changes. So sometimes helping someone get off the inflammatory foods, processed foods, lower sugar, avoiding dyes, artificial preservatives, things like that. If we do find toxins, we will try to remove whether it's mercury, tin, lead, aluminum, mold toxins. I would not say mold toxins are something that consistently cause autism. I think it's more likely that it makes autism worse, although I have some suspicions that moms who were exposed to mold may have more children with autism. I don't have proof and probably will never have studies to know if that's true or not. But for the autistic patient, we're going to look pretty much, I would guess, 98, 99% the same. Again, with a MAPS practitioner for that. And then, once we see that, we're going to look to see if they have markers of increased lipid peroxides, which are oxidative stress markers on cell membranes. We would look at fatty acid balances, whether it's omega-3s, omega-6s, omega-9s, making sure they don't have too long of very long chain fatty acids. We would do a full history to see if there's any prenatal or early life changes. Yes, sometimes vaccines. Could be other toxins they were exposed to, making sure they're not exposed to, say, pesticides or herbicides. So we would walk through those things, work on removing the triggers, making sure the gut is doing well, nutritional balance is correct with the organic acid testing, and then watch those patients progress. Now, we have a number of patients that we care for, kids with autism, where we've seen significant improvements. I talked to one of them today that is, starting to learn to read, where he had had a lot of trouble. He's speaking more now, and I would say it's not just what we did, but getting the toxins, getting the nutritional issues improved, gut issues better, allowed the therapies his parents were taking him to, whereas before it just go speech and OT, and it just kind of didn't seem to get better. Once we got these other things out of the way, he could start progressing and developing like he should. And hopefully catching up. I've had some others who even the teachers were like, what did you do? This kid is a different kid this year than last year. And the scores where they were getting high autism scores, now they're getting up in the normal range. Now, those are kids that are younger in that 3 to 8-year-old range. The older children, a lot of that is we can lessen behavioral, we can improve some cognitive function, but the later you wait, I will say the harder it is to restore some function to the brain where there's been some ongoing damage for 15 years instead of just 5 when it first started. So with that, we have seen some success. We do have at least one parent is willing to talk about their experience and how their child improved with things. So you can ask us. Sam can share that contact information with that parent if you'd like it. I think those are the questions I had here sent in ahead. I'm going to go over here to the page. Kind of technology has been fun today, so let's see if I can get up here and find if anybody's left any further questions. so far I don't see any other definite right now. So if anybody has some questions, definitely leave them, and I'll be able to answer those because you'll be up there first. But I'll take a moment to throw in a few other things about mold and hormones while we're waiting. So one of the other things we'll look for with hormonal effects from mold toxins is looking for an elevated sex hormone binding globulin, something called SHBG. Estrogen, high estrogen will make that go up, but we have seen some of the highest levels, even over 200 in patients who have mold toxins. And with that, we have to detox. That sex hormone binding globulin holds on to, say, estrogen, testosterone especially, so that way, even though your progesterone and estrogen and testosterone levels may be pretty good at the total level, the sex hormone binding globulin, SHBG, holds them too tight and they don't really get much effects. Another interesting thing that we'll see is the fact some women will be super sensitive to even small doses of progesterone. Normally in the perimenopausal or postmenopausal woman, you can start out with 100 or 200 milligrams of progesterone, and they do quite fine with it and benefit. I've had a number of patients who, when you even gave them 25 or 50 milligrams, very tiny doses, almost nothing, would have significant reactions. So if that's something that's happened before, you've noticed that, you're a lady, you've tried some hormones, man, I just had paradoxical, meaning instead of calming, relaxing, it caused you to be real revved up. It could be mold toxins are disrupting the balance so that even low levels become a problem. Often we can get those ladies up to a 50 to 100 milligrams, getting the benefits, but you have to start them slower because they just don't handle the hormones as well. We often also want to be careful with starting testosterone. Even though women need some, it can be hypermetabolized into estrogen. So by giving testosterone too soon, we can cause some estrogen dominance, which then has its own set of symptoms that are not good for women. So with that, those are some of the things we can do. Let's see, no other comments just yet. Let's talk about some way we approach thyroid hormone. We will try to use something called porcine or pork thyroid. There's a few different brands out there depending on what one's available at your pharmacy, but it has T4 and T3. So rather than just getting synthetic T4, it's not a bad medicine, it's only T4, and your body has to convert it into T3. A lot of patients who have biotoxins don't do a good conversion, so they don't fully activate their thyroid hormone, or they turn it off to make reverse T3 instead of regular T3 that has a benefit. So we will look at using low doses of the combination. So they take that, get a little 4, a little 3, and they tend to feel better. Now, not every person who has hypothyroid actually feels better on using the porcine, the pork thyroid. Some actually do quite well on T4 or T3 by itself. You can get both of those pharmaceutically. So it's not a guarantee, but it's worth trying the different forms and seeing which one you benefit the most from. Here's a couple of questions from Ms. Russell. What are Rife machines? What are they used for? Do they work? A friend of mine seems a naturopath who uses one. So a Rife machine uses electromagnetic frequencies to influence biological, physiologic processes. Rife machines were developed, decades ago. I can't remember exactly the first. I know someone who's built one of their own, but you can also buy them. There's a lot of different brands out there where they will say, all right, you can use these different frequencies to treat different conditions. Now, there are some research out there which looks at using Rife machines can cause death in, say, Borrelia, Lyme disease, and different frequencies affect different bacteria and viruses. So at least there's some scientific plausibility, meaning a possibility that those work. And I have some patients who feel like they definitely get a Herx reaction. They feel like some Microbes are dying off when they use the Rife machine. It is not something that I frequently, usually if just a patient comes to me and asks about it. It's not something I recommend because I'm not sure. It's one of those things where it's probably had a lot more promises. It is good for some things, but I think they may overpromise. But you could say that about pharmaceutical industry. So, and sometimes supplement industry overpromises on things as well. But that's how they're basically putting electromagnetic frequencies at certain control, and you can influence body functions from that, with possible some benefit. Ms. Samara, can mold cause allergies in children? Does it just exacerbate allergies that are already there? So one of the ways, we talked about hormones today, but mold toxins, some of them can cause an imbalance between what's called the Th1 and the Th2 arm of the immune system. Th1 is a little more targeting viruses and bacteria. Th2 tends more towards allergy reactions. So it will push you over into making more Th2, T helper type 2 cells, which then augment things like IL-10, cytokines that increase the production of IgE, which are the antibodies that trigger allergies, versus IgG and IgM, which fight more bacteria and viruses. So it does seem to increase that. The other thing that mold toxins can do, some of them will cause leaky gut. Leaky gut means the cells are not as closely attached. There's more space in the intestinal wall. If you get more proteins from your food or whatever you're eating, bacteria that's in your food coming through your system, and you have leaky gut, you're more likely to react. So you can make more IgG, more the Th1 type of antibody, or you can make more Th2, the IgE, causing more allergies. So we will see patients who have mold toxins having more allergies, but it could also, yes, to some degree, the answer is both. It can make allergies that are there worse, or it could cause some people to have brand new allergies, and if you remove them, they at least get better, or they may sometimes go away. So we will look for those and often see quite a bit of improvement in patients' allergy symptoms, but also some of the therapies we use, because sometimes detoxing mold, allergies worsen before they get better because we're pulling toxins through, and we'll use things like quercetin or other mast cell stabilizers to manage the symptoms, and patients find, oh, this really helps my allergies, and they end up taking it longer term. All right, I think we're coming to a close here. So I'm going to have another meeting coming up in a few minutes, but I'm looking forward to next month. We're aiming ideally for March the 18th. We're going to have a special guest. Haven't done a guest in a while, but we're going to have a holistic realtor, Heather Rose, who helps patients, people, not just my patients, but helps people in the Middle Tennessee area find houses that are safe, ones that don't have chemicals, don't have mold, and also connect them to other healthy businesses in the area. So she has a great website that we will share with you at that point, but as long as all the details work out, we'll be sitting down with Heather and talking a little bit about some of the things that she looks for when she's helping people buy houses, to know that it's a safe house, that they don't have to worry about getting sick when they move into that house. So I look forward to seeing you next month. We'll let you know exactly if the 18th is the final date for that. And until then, we hope you're living a healthier, more abundant life. But if you're not, we're glad to help out or teach you a little bit about your health with our SFM Empower and video library. So I look forward to seeing you then.